Rhinoplasty is a procedure that I do quite frequently. It involves reshaping the nose, especially the bridge of the nose as well as the tip of the nose. And bringing that all together in a balanced and symmetrical fashion is really what our patients want.
I learned about Dr. Gross basically doing an internet search. I was looking for a facial plastic surgeon. Video imager played a big role in deciding for Dr. Gross because the previous doctor I went didn't have that tool and he didn't even show me any pictures. And when I came here, there were plenty of pictures, there were plenty of references that they gave me, and I was able to see, myself at least how it was going to look like, and actually it looks better.
With the help of the computer video imager, I can show my patients what they'll look like after surgery so they can have a realistic expectation even before they decide if they want to go ahead with rhinoplasty surgery. This is really a valuable tool to have that computer video imager available.
My name is Mariela Jimenez. I'm 22 years old and I'm a collector. What brought me to do a research for plastic surgery and specifically to Dr. Gross, well, first of all, I wasn't feeling okay with my nose. I thought it was too wide and not too attractive, and I wanted to find a good surgeon who specializes in rhinoplasty and especially in facial surgery. And doing a research on the internet, I found Dr. Gross' page and I thought he was what I was looking for. And my first appointment with Dr. Gross, looking at the photo imaging, it was an amazing experience for me.
You're now in the video imaging session. I have Mary Ellis's photographs on the plasma screen TV behind me, and I will take the before and after pictures and make modifications to them with the morphing software on the computer and make changes to Mary Ellen's nasal tip to make it narrower and thinner, and also to narrow her bridge where she's a little too wide. And you can see that in the picture on my right. She'd like to have her nose narrower at the top, narrower at the bottom, and more refined at the tip. Okay, we're now in the imaging session with Mary Ellis's photographs, and these are the problems that she's been talking about and would like help with. The wideness across the bridge of her nose, you can see very apparently here. She also has wideness at the tip of her nose, which you can see here, and a little bit of a roll on each shoulder just above the nostril here and here, which she would like eliminated. With the picture on the right, I'm now going to begin morphing the changes for the top of her nose. So you can see the rectangle that I placed around the bridge of the nose. Now we'll put it on the other side, bringing it in towards the middle. Now we're starting to see more shape at the bridge of her nose, and we'll start the same process with the nasal tip. And this is the actual imaging session that we go through with each patient, modifying and adjusting it so it looks just right and it balances for their anatomy and for their facial size and features as I see and as they see. Now here at the nasal tip you can see more refinement. I'm actually going to bring the nasal tip in just a little bit more. And we're getting closer to the final result that Mary Ellis has asked us for. And now I'm going to bring in the base of the nose just a little bit, and again a little bit more at the bridge. Surgery is performed much like this, with subtle refinements throughout the procedure to get it just right. I'll go over to our before and after tool, and you'll see when I click on this flip button, the animation graphic will go into motion. Now you can see in this area she's at her before pose. When I click this button, she's at the after pose. We'll do it again. Here she is before. Here she is with her after result. And this nose balances perfectly for Mary Ellis's facial height and her features. Now we can see more of her eyes when we look at her picture and concentrate less on her nose. And this is a beautiful result, and this is exactly what I would plan for Mary Ellis for her final result. Well, when we take the casts off or the splint off 1 week after the rhinoplasty procedure, typically my patients will break into tears of joy when they see how beautiful their nose looks and how good it looks so soon after their cast comes off. This is usually the eureka moment, the wow moment, and the time for joyful tears. And that's what really gives me the fulfillment and reward and the passion and the love for what I do.
So I'm just taking some Q-tips here. It has some little bit of rubbing alcohol on it. So it's just kind of to loosen up that tape there. Wow.
So perfect.
It is absolutely perfect.
When I saw my new nose, it was very, very exciting. I was with my fiance and he was super happy. He couldn't believe the results. After the surgery, I do feel better about myself, especially when I'm doing training or conducting meetings. I feel more confident because before I thought that everybody was looking at my nose. The results are very natural looking. It doesn't look like a fake nose, so that's what I was looking for. 5 days after my surgery, I went to work and people didn't notice that I had a surgery. They knew I looked better and different, but they thought I was on vacation.